Naltrexone has a neuroprotective effect as well as an analgesic effect. So not only does it help with pain and inflammation, it protects the nerves. And it's because of these cells called microglia. It activates them in the brain and in the spinal cord. And by suppressing the activation of microglia, naloxone or naltrexone reduces the production of basically neurotoxic chemicals in the brain and the spinal cord. And basically, what we see is that our general markers of inflammation actually decrease when people are on low dose naltrexone. So basically, we can, if you look at and I talked about this earlier, the LDN Research Trust, basically they've been around. They are trying to educate doctors. You can be a member of this group. You can donate to it. But basically, they look at things like the safety of it, which far and away, LDN is very, very safe. I've never seen any sort of issues with it, except for some stimulation. Like usually I'll start women at bedtime. And if they find that they're too stimulated at night, I have them take it. What we are finding, though, and this is pretty common nowadays, is there are a lot of fake medications out there. So you need to be careful where you're getting it. I wouldn't buy it online. I would only get it from a compounding pharmacy. That is the other piece of this, is that there is it has to be made in a compounding pharmacy because there aren't any particular areas, except for there is a medication on the market called Contrave, and Contrave is low dose naltrexone and a migraine medication, and called Trexamet, and one of the side effects actually of low dose naltrexone is decreased appetite. So what they found was, and I used low dose naltrexone myself for migraine, and what I found was that I lost like 20 pounds, and actually my mood got a lot better. Like I just felt better. I felt happy. And that's probably that the mood elevation comes from you making more of your own natural endorphins. So basically, what are the conditions that are currently being treated? There are conditions with the heart. There are doctors out there using it for autoimmune cardiomyopathy, myocarditis, something called ITP and TTP, which is a thrombocytopenic purpura, where you basically attack your own body's clotting disorders. They're using it for things like Kawasaki's disease and vasculitis, where you have an autoimmune disease where your body is basically attacking your blood vessels. It's being used in chronic pain, diabetic neuropathies, and peripheral neuropathies. It's being used in some skin conditions. I mean, the list is endless. Women that really struggle with lichen sclerosis, which is a disorder where the vulvar area gets severely itchy and the immune system is attacking the skin down there, can have some good responses. For endocrine issues that are being treated, Addison's disease, Cushing's, diabetes, hypothalamic issues. I use it for PCOS and for Hashimoto's, but it can be used in a lot of endocrine disorders. Gastrointestinal issues, the list is huge, but celiac, pancreatitis, gastritis, gluten sensitivity, gut dysbiosis, the ulcerative colitis, Crohn's we talked about, neurologic issues. Again, the list is huge. Even things that you wouldn't think about, like brain fog, optic, neuritis, Tourette's, migraine, like I talked about before, Parkinson's. It's being used for tons and tons of stuff. In women's health, though, mostly what it's being used for is autoimmune stuff, endometriosis. Some people are actually doing studies right now on pregnancy to see if it helps with pregnancy outcomes, like decreasing the rates of blood pressure issues and things like that. Herpes, infertility, premenstrual syndrome, polycystic ovarian syndrome, pregnancy, like I said, progesterone dermatitis, recurrent vaginitis. I haven't personally used it for that, but apparently there's some people using it for that. Vulvodynia. I have used it for vulvodynia, which is a disorder where women just report pain in the vulva, and there is no significant causative agent that we can find. And also for dysmenorrhea, which is just painful periods, and I have used it for that as well. And they're also using it in cats. So for people out there that love their cats, if you have a cat that's suffering with basically feline AIDS or leukemia, they actually have been using it for that. So low dose naltrexone, when you go see somebody, if it's something, I always feel like part of the issue when we talk is, how do I get my doctor to even consider it? And again, it's hard because you can't really make your doctor do anything. I talk about this all the time. If they don't know how to prescribe it, then they're not going to use it. And you can't convince them to learn something they just don't have time to learn. So what you want to do is, you're probably going to want to look for somebody who has a functional background or an integrated background like myself that looks, we're constantly always out there looking for different studies and different things, and we're in groups and we talk to other doctors, and we're really trying to find our way through this quagmire of medications and different disease processes and what's new and what's being studied. So first of all, I wouldn't go in and start demanding that they do this, that, or the other thing. Obviously that never goes over well. You can talk about it. You can ask about it. Like, hey, have you heard, especially like, let's say you have endometriosis. Have you heard about low dose naltrexone? No, what the heck is that? Oh, it's the medicine that's in Contrave, which is a weight loss medication. I know about Contrave. I've prescribed Contrave. So that gets you in the mindset with them that they've already prescribed it. And a lot of doctors do prescribe Contrave because it does help with weight loss. So if they bite on that, like they've already prescribed Contrave, then they're used to low dose naltrexone. I've been reading some things like, I'm in this endometriosis group and there's some women on it and it's really helping them, and it helps with the pain and it helps recurrence go down possibly. And I just was really interested in trying it. And the doctor might say to you, yeah, that's great. I don't know how to prescribe it though. I called a local compounding pharmacy and they said they'd be more than happy to walk you through it, or they gave me this handout that shows you how to prescribe it. So you might have to do a little extra legwork. And the compounding pharmacists that are in your town are always usually very helpful. Not always, usually, that doesn't make sense. It's like the line from Ron Burgundy where the guy says 60% of the time it works every time. But usually they're going to be open. The compounding pharmacists will always be open to helping you because, for them it's business, but they like to educate as well. They like to not only help the patients, but they want to help the doctors, learn and how to do things. So you might have to do the extra legwork and going to a compounding pharmacy, asking them if they have prescribing information that you might be able to hand to your doctor, or who can the doctor call, and really that's when you find out if your provider is open to listening. And like I say, they could be great.